So the most common cause of having to replace the hip is usually arthritis, and that's very common in patients predominantly in the older age group, but actually can occur in anything from mid-30s right the way up into their 80s. Arthritis is when the cartilage inside the hip is worn away, and that usually happens because of there's something wrong with the shape of the hip, which may have been there since their childhood, but the patient wouldn't have known about it until they're much older. So we'll often see patients with a range of problems going from a simple cartilage tear in the hip all the way through to completely worn out and then needing a hip replacement. A hip replacement is a very common procedure done now in the UK, and essentially it involves replacing all the worn out parts of the hip joint that are moving together. So it involves changing the cup and the ball of the hip and putting in artificial versions which can then move without any pain. The hip replacement is probably the most successful orthopaedic operation you can have, and generally speaking, between 90 and 95% of patients are delighted after surgery. Well, certainly we try and improve pain as much as we can before we go for surgery, so everybody will benefit from a degree of physiotherapy to make their muscles stronger and get their joints moving better. There's certainly a role for taking tablets to help their pain and reduce the inflammation. Sometimes we use various types of injections to improve their pain or to pin down where their pain is coming from. But in the end of the day, if there's significant arthritis, then the best treatment is a hip replacement. Sometimes we see patients earlier on in that journey when they may just have mild arthritis or cartilage tears, and in those cases we'll often use keyhole surgery techniques to try and correct the damage and so preserve the hip and make it last longer. In some ways we're victims of our own success in that hip replacements are so successful, but one of the major long-term problems with a hip replacement is that eventually it will wear out, and so if you're treating younger patients, there is that worry that they may need multiple revisions in their lifetime. So now we're trying to preserve their own natural hip, and we'll do that by using keyhole techniques, and increasingly we're using stem cell treatments to try and regenerate their own natural cartilage. So stem cell treatment is a relatively new form of therapy where we take the patient's own cells, often from their bone marrow, and then we use our keyhole techniques to replace damaged areas inside their own joint, and so regenerate their own natural cartilage and allow the hip to last significantly longer.